online course Rest and Sleep, presented to you by caregivercloud.com and the CNA Registry at cnaclasses.us. Many people who are recovering from a serious illness or injury, as well as elderly patients, may have a great deal of trouble sleeping. This could be because they are suffering from insomnia due to the effects of their age, from pain or discomfort that they are in, or as a direct result of medication that they are taking. No matter the situation, part of your responsibility as a certified nursing assistant will be to ensure that you understand how much your patients need to sleep and what you can do to help them get the sleep they need. Understanding the need for sleep. Sleep is important for every human being. Without rest, our minds cannot function well, we will be more prone to illness, and we will not have the physical energy. As a CNA, you need to know the importance of sleep and what that means for those under your care. During your Rest and Sleep CNA class, you will learn information on sleep patterns such as the following. A patient needs at least 8 hours of sleep every night. Elderly patients need more sleep, including naps throughout the day. Children need more sleep, up to 11 hours per night. Understanding what is needed from sleep will give you a better handle on how to properly care for the people in your charge. The problem of insomnia. You will likely have numerous different patients who struggle with sleep. Reasons for this include pain, discomfort, medications, and more. You need to know what actions to take should your patient be struggling with getting to sleep. Some of the things you could do would include: give the patient a back rub to help them relax. Call the nurse to administer a pain pill if the patient cannot sleep due to pain. Ask the nurse about sleeping pill options for those patients who just cannot get to sleep. You should never let your patients go without sleep. They need that sleep to heal and recover and to stay strong. If you see any signs that the person in your care is not sleeping, you should consider calling a nurse. Your patient may have a prescription for sleeping pills. If this is the case, then a nurse can provide one. If no sleeping pills are available, you can take steps to ensure that your patient is comfortable and relaxed enough to hopefully fall asleep. People need sleep. This is a simple rule. Doctors recommend at least 8 hours of sleep for any adult. Your job as a certified nursing assistant is to do everything possible to ensure your patients are getting the restful sleep they need. During this CNA course, you will learn more about things that could be hindering sleep. You will also learn more about how you can help a patient get to sleep and when you should call for help from someone above you, like the nurse. Proper patient care always includes evaluating sleep and sleep problems so they can be rectified. Compared to the sleep habits of young adults, elderly adults need to take naps more often. The elderly often have trouble sleeping in the night due to illness, stress, and more. This requires them to take a nap or two throughout the day to re-energize them for activities. Your patient rings her call light at midnight and tells you that she's having trouble sleeping. You should notify the nurse. Many patients have prescriptions or standing orders for a sleeping pill if they have difficulty sleeping. The nurse should be notified right away so the patient can be medicated and it can take effect. The following is something a nursing assistant can do to help a patient fall asleep. Give a back rub. A back rub is a simple task that a nursing assistant can do to help a patient fall asleep. Do not threaten the patient about getting up early. If the back rub doesn't work, a nurse can give the patient a sleeping pill, but passing medications is out of the nursing assistant's scope of practice. You are assigned to a patient who just had hip surgery. He rings his call light because he can't sleep, and you know that this could be because he could be in pain from the surgery. New post-op patients often have trouble resting and sleeping because they are in pain. Notify the nurse that the patient is having trouble sleeping, and she may be able to treat the pain with medication. If that is unsuccessful, a sleeping pill may help. The recommended number of hours of sleep an adult should get each night is 8 hours. On average, adults should have 8 hours of sleep at night to keep their bodies healthy and their minds functioning properly. Children may need up to 11 hours of sleep, and infants will sleep about 16 hours a day. This concludes the online course Rest and Sleep, presented to you by caregivercloud.com and the CNA Registry at cnaclasses.us. Thank you for taking this course.